Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going over Tori Spelling.
Part 2.
She mentions doing exosomes, and I think people should know what that is, how that can make you look younger, feel better, more attractive.
It's the exosomes. I'm
It
telling you, I told you, it is the fountain of youth. I thought it was interesting that you were in there with a lot of different people with an IV.
I was
Right?
for the exosomes, right?
Yes.
The IV drip.
So let's explain what those are. Does anybody know?
To make it simple, if you looked at stem cells like mini doctors in your body, what exosomes are the medicine, right? So they're what the stem cells secrete to heal things. When a stem cell arrives at a site of injury or a site that needs to repair something, it releases the exosomes. And so now what scientists have found out is a way to cause these stem cells to just secrete those exosomes, isolate them, and now just re-inject the exosomes without the living stem cell. So for people, that's great. And now there's even a way that we're able to isolate the different types of exosomes, so specific ones. Some are more anti-inflammatory, some are more anti-aging, some are more specific to certain tissue types. So now it's really becoming a fascinating field because we're able to isolate those exosomes and really target different things that are going in the body rather than just giving a mixed bag or soup of exosomes and stem cells to everybody.
Okay, so that definitely leads me into my next question. Because when you mentioned there's different types of the exosomes, and we know for a fact Tori Spelling has elected for exosome treatment, she likely had some sort of anti-aging exosome
Maybe.
treatment, right?
Maybe. Well, just like any marketplace, we don't know. And maybe she doesn't know. And that's why people got to get educated, because you may go somewhere and get exosomes that are completely bunk. They may not, you don't even know what they are. They may be the wrong type, or they may not be what you wanted them for. So you have to ask a lot of questions about these things before you pay good money for them. There's many different sizes, types, different uses, so people don't just go and get exosomes. You have to ask all these questions about, like, where are you getting them? How are you getting them? What type are they? What size are they? How many are there? Is it billions, millions? They're all different types of questions so that you know what you're getting for your money.
I anticipate there will be a big reaction to this because it obviously, well, I don't know, it may not be obvious to you, but to me it seems like almost too good to be true. I'm not saying it is, but just like a beauty IV seems crazy, right? So I'm not saying you have had exosome treatment or not, but if maybe you had, or someone you knew had done it, does it hurt? Like what does that process feel like as a patient?
Well, there's different ways to use the exosomes. One way is intravenous or an IV, so it's a small little needle and an IV push, and those sort of things, again, is for overall rejuvenation of the entire body, or if there's a certain area of inflammation in the body, they can home in on it. One other interesting thing about exosomes, I don't want to get too scientific, but is that stem cells are so large that when you inject them intravenously, a lot of them get trapped in your lungs. And that's good for certain things, like if you have lung problems. But on the other hand, if you need to get to other parts of the body, they don't. Now, exosomes, on the other hand, are small enough to get through the lungs into the entire body. They can even cross the blood-brain barrier into your brain. So there's a lot of studies and a lot of things going on as far as using these exosomes for many different things, whether it be aging in the brain, trauma to the brain, trauma to different areas of the body, inflammation in different areas of the body. So I think it's not a big painful surgery. It's not a surgery at all. It's just a little injection. So it's not a big painful procedure. And secondly, what's the risk? There's not much risk in this. A lot of people are worried about stem cells and living cells in the body. This is just more of what we'd call peptides sort of things, or not necessarily, they're not living cells, they're just signaling molecules. So a lot of people feel better about that, safer about it, very low risk, potentially high reward. Again, for me, that's a procedure that people would want to look into.
The first comment is going to be like, you inject baby fetuses into your body or whatever. This is not that.
No, none of the stem cells or exosomes that are used should ever come from fetuses and babies, okay? Those are embryonic stem cells, very dangerous, a lot of ethical concerns. Only type of cells that people are injecting are either umbilical cord, which are from babies that were born and the umbilical cord was left over, or the second type is from your own fat. And those are called adult stem cells or adipose-derived stem cells. So those are the two main types, and we're even finding ways to isolate exosomes from your own fat stem cells. So this field is really expanding rapidly. But yes, people should be aware that this is not from fetuses and that sort of a thing, because nobody should be doing that sort of procedure.
And back to Tori Spelling, she didn't have little babies injected into her face to make her look youthful.
I hope not. not that I know of, but yeah, hopefully not. No, I mean, I don't even think that sort of thing isn't even available, So that was it was the original research where the government came in and stomped on all that. That was, yes, embryonic research, and those can cause problems, and again, not only ethical concerns but also medical concerns. So none of those are used anymore. But a lot of people do get confused with that and think that that's what we're talking about, and it's not at all what we're talking about.